Right now we are starting with a subject called as radiology. Radiology. Sir, these are some discoveries and previously asked questions were there from the discoveries. That is why just let's go through these discoveries. Then system by system we are going to cover the radiology, because radiology is having overlap with so many subjects, even medicine, even your orthopedics, even your surgery. Everywhere you will see the radiology. Done, sir? So let's start with this thing. Now, first of all, X-ray. X-ray is discovered by the beautiful scientist 𝗲𝗵𝗵 Roentgen. 𝗲𝗵𝗵 Roentgen. Then coming to the CT. CT में कौन रहता है? God. God का घर वही है Hounsfield. तो Godfrey Hounsfield. X-ray was by 𝗲𝗵𝗵 Roentgen and your CT scan by Godfrey and Hounsfield. My dear friends, MRI was discovered by 𝗏𝗏𝗏𝗏 and Mansfield. 𝗏𝗏𝗏𝗏 and Mansfield. X-ray becomes our first investigation of choice in most of the cases. CT is best for your bony part, or you can say the local invasion. You have to check. If you have to check the bony destruction, you have to check best is CT scan. If soft tissue involvement you have to check, then my dear friends, MRI will become your investigation of choice. Now radioactivity is also MCQ which was asked in the exam. So radioactivity is by the becquerel. Radioactivity is by the becquerel. So my dear ladies and gentlemen, let's start with this very first system, and that is none other than your GIT. None other than your GIT. Now by different contrast medias we have to use. Different contrast media will tell us where we are looking the pathology. So very important. Then some pathologies we'll learn about, and we will get all the high yield topics from the radiology integrated with your surgery also. And other pedia even. I'll be covering CVS pedia ka yahan pe. Now sir, barium swallow. Any pathology in the esophagus, if you have to check, you will give a contrast media called as what, sir? Your barium swallow. Barium swallow, like Zenker's diverticulum, like 𝗏𝗏𝗏𝗏. So we'll go for the barium swallow. Then if any pathology we have to check in the abdomen and proximal part of the duodenum, then we are going to talk about the barium meal. So first of all, swallow. After swallow, there is a meal. Then coming to the barium meal follow through. So follow through is after duodenum, proximal part of the duodenum, what will come, sir? Small intestine. So small bowel problems, if they are there, like intussusception, etc., then you will go for the barium meal follow through. Now, if there is a large intestine pathologies, my different toxic mega colon, etc., then you will use a barium enema. Barium enema. Done. Okay. Now, coming to the disease number 1, sir. Disease number 1. Question 1, sir. Question 1 is Plummer-Vinson syndrome. Now, what is happening in the Plummer-Vinson syndrome? There is going to be the iron deficiency anemia. There is going to be the cricopharyngeal webs. So here you can see the image where there is going to be the cricopharyngeal webs. After that, there is going to be the iron deficiency anemia. What are the features of iron deficiency anemia? Can you tell me what is a clinical feature of iron deficiency anemia? Yesterday itself, I have taught you in another session of pathology. The day before yesterday, we talk about the iron deficiency anemia. Can you tell me the feature you are going to see on the nails? Clinical feature I'm asking about the, yes, cholionychia is a clinical feature we see, sir. So right here, esophageal web is there. Because of this web, are you able to digest things easily? No, your answer is no. Your answer is what, sir? No. Then your answer is what, sir? Dysphagia is also there. So cricopharyngeal webs are there, dysphagia is there, iron deficiency anemia is there, plus one more feature you can see, that is your glossitis. So mnemonic is CID. CID wale kahan ghus jate hain? Ghar mein ghus jate hain. So your C stands for cricopharyngeal web. C stands for cricopharyngeal web. I stands for iron deficiency anemia. Dietary deficiency will be there, because of which you will have an iron deficiency. D for dysphagia. Because of this cricopharyngeal webs, there will be a dysphagia. And my dear friends, G for glossitis. So Plummer-Vinson syndrome, which is also called as Patterson-Brown-Kelly syndrome, which is also called as what, sir? Patterson-Brown-Kelly syndrome. The mnemonic is CID and GHAR. So this is what you need to remember for your exam. This question has been already asked in your previous exams, my dear friends. Now coming on to the next disease, and that is Zenker's diverticulum. Can you tell me, in the ENT session I have taught you something, this Zenker's diverticulum is outpouching. From which part? Which discence I am talking about, in which muscle? Which distance and which muscle we are talking about, my dear friends? Yes, absolutely correct. Please try giving answer. Yes, very nice answer. This is your Killian's distance. And which muscle we are talking about? Inferior constrictor muscle. We are talking about what, sir? Inferior constrictor muscle. तो यहाँ पे क्या हो रहा है? Inferior constrictor muscle के वहाँ से there is a outpouching coming outside, and that outpouching is visible on. Now this is which contrast media? If we are checking any pathology on the esophagus, can you tell me which contrast media we are checking right here, sir? Which contrast media we are checking right here, sir? Which contrast media is this? Yes, your answer is what, sir? Contrast media is barium swallow. Contrast media is what, sir? Your barium swallow. Barium swallow. And here you can beautifully see, if a patient is having Zenker's diverticulum, there will be a clinical feature. Can you tell me what is that? The food will be stuck here, and because of that, foul smelling breath will be coming, and that is called as halitosis. Halitosis. The clinical feature is going to be what, sir? Halitosis. The patient is going to halitosis, plus there will be a dysphagia. Plus there will be what, sir? Dysphagia is going to happen. Dysphagia is going to happen. So this is Zenker's diverticulum, outpouching of a mucosa through the weak mucosal layer, and this is how you are going to see on the radiogram. Very, very good. The third is going to be what, sir? 𝗓𝗵𝗵𝗺. Now what is happening in the 𝗓𝗵𝗵𝗺, sir? The lower esophageal sphincter tone, the lower esophageal sphincter tone is going to reduce. Now what is happened? There is a lower esophageal sphincter. They are failing to relax. If they are not relaxing, they will be contracted like this. They will be contracted, and their contraction is depending on the weight. So if we take a liquid, they will get stuck here. But if we take a solid, solids are heavy, so they will open it. So dysphagia is there, my dear friend. Dysphagia is there. So dysphagia is for liquid more common than the solid because of the weight. Liquid more common than solid, and that is because of the weight, my dear friend. That is because of the weight. So here on this contrast media, which is barium swallow, we are going to see the bird beak appearance. We are going to see what's a bird beak appearance. Can you tell me the name of a surgical procedure what we are going to do right here to treat such condition? Yes, this is going to be POEM, per oral endoscopic myotomy. And sometime, yes, people are right about the rat tail. Rat tail here is a regular, or you can say smooth margins. But in the esophageal carcinoma, that is with the irregular margin. That is with the irregular margin, sir. So here, 𝗓𝗵𝗵𝗺 is also done and dusted. Done and dusted. Now, per oral endoscopic myotomy. तो यहाँ आपको निमोनिक कैसे याद रखना है? 𝗓𝗵𝗵𝗺 में बर्ड बीक साइन देखने मिलता है, और बर्ड क्या गाता है? पोएम गाता है. Let's talk about the next is carcinoma esophagus. Sir, carcinoma esophagus, if you see, upper 2/3 part is having squamous lining and lower 1/3 is having what, sir? Adenocarcinoma. Here the filling defect is initially the dysphagia we talk about. Dysphagia is for solid more common than the liquid. Solid more common than the liquid, sir. ठीक है? Now, solid more common than the liquid, sir. Here you remember the bird beak sign is there. Sorry, rat tail appearance is there. Rat tail appearance is there, but the irregular one. Irregular. In the surgery, we are going to talk about the surgical treatment of. So proximal margin we take 15 centimeter. Distal margin we take 5 centimeter. How to investigate? We will use a endoscopic USG. Endoscopic USG initially. Then we take an endoscopic biopsy. Local staging के लिए we do a MRI. Metastasis के लिए we do a CT scan where it is going. So all those things we will learn in a surgery also, sir, about the cancer esophagus. Cancer esophagus. Now coming to the next condition, that is condition number 5, diffuse esophageal spasm. My dear friends, diffuse esophageal spasm itself is telling you this is a spasm of the esophagus, which is making the esophagus looks very, very irregular. And there is a filling defect on the barium swallow investigation. You are going to see which appearance. This is called as corkscrew appearance. This is a motility disorder, or in short you can say painful motility disorder. Painful motility disorder in which you are going to see the corkscrew appearance. Corkscrew appearance. Corkscrew appearance, my dear friends. Now coming on to the next one, that is congenital hypertrophic pyloric stenosis. My dear friends, congenital, that means initial weeks. So remember, present in few weeks after the birth. That is first thing. What do you mean by hypertrophy? Hypertrophy means increase in size of cell. Increase in size of cell. And where it is happening? At the pylorus. If at the pylorus the cell size is increasing, there is going to be the stenosis. There is going to be the stenosis. And which contrast media now we are using right here, sir? Can you tell me? Which contrast media? Is it barium swallow or is it barium meal? So your answer is going to be barium meal. Barium meal. And which sign you are going to see right here, sir? Because of the narrowing of the pylorus, because of the stenosis of the pylorus. Can you tell me which sign you are going to see? This is called as mushroom sign. This is called as mushroom sign. And this baby will be presenting with the vomiting also. This baby will be presenting with the vomiting also. Can you tell me vomiting की अगर बात करेंगे, so which vomiting is going to be there? With HCl. The HCl, sorry, acid is going to come out. Okay, acid is going to come out. And is it bile stain vomiting or non-bile stain? Because there is an obstruction in the pylorus. The vomiting is going to be the non-bile stain vomiting. Plus, when we are palpating, there will be a olive-shaped lump. There will be a olive-shaped lump, my dear friends. So here see, child present with the non-bilious vomiting, per abdomen olive-shaped lump. So your acid is going outside. Your acid is going outside, because of which what will happen inside? Metabolic alkalosis. You are going to see what, sir? Metabolic alkalosis. Metabolic alkalosis. Metabolic alkalosis. Done and dusted, sir. Done and dusted, sir. Now coming to the next one is seventh one, diverticulitis. Diverticulitis. Now diverticulitis, you will see small outpouching in the diverticula. We are talking about the large intestine, where you will see the small outpouching is there. And on the investigation, what we are putting right here from here, we are putting which contrast media? Can you tell me which contrast media we are talking about right here? Please identify that contrast media we are talking about right here, sir. The contrast media which we are using right here is, this is barium enema. Very, very good. And which this appearance is called as? This appearance is called as, sir. What this appearance is called as? Yes, many of my friends have already guessed. This is called as sawtooth appearance, my dear friends. This is called as what, sir? Sawtooth appearance. Sawtooth appearance. Wonderful answer and a wonderful performance by each one of you. Approximately you will see in an exam 30% questions are very easy. 30% are very easy like these. Sir, 40 to 50% are moderate questions. Moderate questions mean you need to apply some logic along with that. And sir, again 20% what are left, they are tough questions. So tough questions are 20% and doable are at least 80%. Out of this 80%, 30% is very easy stuff. In that 30%, make sure you make minimum silly mistake. Silly mistake is going to happen. But in those 30%, try to avoid that. And that happens when we are very overconfident or under studied. The two things are there. Either we are very much enthusiastic, ये तो आता ही है, ये तो छोड़ो, या तो हमें बिल्कुल नहीं आता. तो उस केस में easy questions के अंदर गलतियां होने के चांस रहते हैं. तो be in somewhere in the equilibrium where you will fall in the 80% of the category, and definitely you guys are going to pass the exam, sir. Now, diverticulitis, basically investigation of choice, if someone is asking, then is going to be the CECT, but initial first investigation, barium enema, we will put and we will see a sawtooth appearance, sawtooth appearance, sawtooth appearance. Okay? Chalo. Let's talk about the colon cancer. Let's talk about the colon cancer, my dear friends. Colon cancer, if we talk about, sir, colon cancer, you will see, it is risk factor is mostly because of what? Red meat. Red meat की वजह से mostly common होता है. It is right-sided colon cancer, left-sided colon. One will obstruct, one will bleed. In treatment, we do right hemicolectomy, left hemicolectomy. But here you need to focus on the defect. On the barium enema, again you are going to see the apple core defect, sir. Apple core, typical feature, radiological sign you are going to see in the colon cancer, and that is going to be your apple core. Also, the gene involved is C for colon and sounding like a K. There is going to be the KRAS gene mutation. KRAS gene mutation. KRAS gene mutation is going to be there. Done, sir. Now coming on to the next one, most common cause of most common cause of obstruction in the children, and that is going to be the intussusception. See sir, what is happening in the intussusception? There is going to be the telescoping of the intestine. There is going to be what sir? Telescoping of the intestine. And what different type of signs you are going to see? So my dear friends, remember, number one, you can see right here sir, coil spring appearance. Sir, claw sign you are going to see, sir. Donut sign, this is also called as what sir? Target sign, my dear friends. Also you are going to see sausage shaped lump. So these are the signs which are associated with the intussusception. Plus the stool is going to be the red recurrent jelly stool. Red recurrent jelly stool. Can you tell me which vaccine is associated with the intussusception? Another MCQ you can add right here. Which vaccine we have to talk about? Yes, given a correct answer, and that is going to be the rotavirus, sir. That is going to be the rotavirus. See how well you guys are trained, how well you are revising in such a short time. Such high yield content is there with you, and if you are good to go further, you can solve some more MCQs, which will give you idea what extra things I need to add on in my knowledge. Sir, beautifully done, beautifully done. Now let's talk about the 10th one, that is ischemic colitis. Sir, ischemic colitis, where you will see the ischemia, and ischemia on the X-ray looks more black. So here you will see a beautifully right here, you can see right here, thumb printing sign. What you are going to see, sir? Thumb printing sign, thumb printing, ischemic colitis. Done, sir? Then coming to the different type of bubbles. Bubbles are asked multiple times. As I told you, these topics belongs in the 30%, which is easy doing questions in the exam. So first of all, let's talk about the pyloric atresia. What do you mean by bird atresia? Atresia means absent. Some structure is absent. Okay? Absent. Then coming to the single bubble sign. In the pyloric atresia, you are going to see the single bubble sign. In the duodenal atresia, you are going to see the double bubble sign. What is another condition in which you are going to see the double bubble sign? Any guesses is there? And this has been asked in your previous exam also, my dear friends. Which other condition is associated? Yes, given a very correct answer. Annular pancreas. When the ring of the annular tissue is covering the duodenum and constricting it, there will be again a double bubble sign. Annular pancreas. Annular pancreas is going to be the answer, my dear friends. Then coming to the jejunal atresia. Jejunal atresia, you are going to see the triple bubble sign. Triple bubble sign. Now, can you tell me when you are going to see the multiple bubble sign? When you are going to see the multiple bubble sign, sir? Where you are going to, which condition you are going to see the multiple bubble sign, my dear friends? The multiple bubble sign is a condition seen in, yes, you know the answer, you can give the answer. The multiple bubble sign is intestinal perforation. So now another sign, cupula sign. Cupula sign you will see in, another sign, please tell me. Cupula sign you are going to see in, yes, cupula sign you are going to see in peritoneal perforation, where gas will be under the diaphragm, where the gas will be, very good, peritoneal perforation. Pneumoperitoneum hoega jab. So here we are done with this part. Now sir, sigmoid volvulus, again a multiple time asked question both in FMGE and NEET PG exam. This sigmoid volvulus, what is happening? Your sigmoid colon is wrapping against itself. You have seen two dogs fighting with each other, and one tail there, here. That is what, sir? Anti-clockwise rotation is there. Same thing is happening here. Now this is going to show you the beautiful sign, and this is called as coffee bean sign. One more sign is seen here, that is called as bird of prey sign. Bird of prey sign is also seen right here, sir. Bird of prey sign. Okay, sir? Chalo, sir. Let's talk about the next, and that is your ulcerative colitis. Ulcerative colitis. Ulcerative colitis. Can you tell me the drugs we have learned in the ulcerative colitis? What drugs we have given? Gali se associated hai. That is what I can tell you, and as a hinting word for this diagnosis. Ulcerative colitis. Yes, my dear friends. Can you please let me know what we are talking about? Sir, first of all, you will see which sign you are going to see. Here you can appreciate right side. Here you can appreciate right here side. This is ulcerative colitis ka lead pipe. Others are collar button, pseudopallic, granular mucosa. Ulcerative means superficial. You can see mucus or submucous is involved. Superficial layers are involved in the ulcerative colitis, and main feature you are going to see 𝗲𝗲𝗃, 𝗲𝗲, 𝗲𝗲. Yes, Tania Firdos has given a correct answer. Now coming to the next, in the Crohn's disease, what you are going to see? The Crohn's disease, you are going to see the string sign of Cantor. String sign of Cantor. String sign of Cantor. String sign of Cantor you are going to see, sir. Also in Crohn's disease, you will see the skip lesion. Skip lesion. Skip lesion. Can you tell me from pathology which ANCA you are going to see in the ulcerative colitis and which ANCA you are going to see in the Crohn's disease? Okay, which ANCA you are going to see in the ulcerative colitis and which ANCA you are going to see in the Crohn's disease? Can you tell me? In the Crohn's disease, it is going to be the P ANCA. In the ulcerative colitis, it is going to be the C ANCA. Perfect answer. If you don't know, totally fine. But we have learned after attending the class. That matters the most. That matters the most. Shabash. What a wonderful performance by each one of you. Beautiful, beautiful answers by each one of you, sir. Now coming on to the next one, sir. Hydrid cyst. Hydrid cyst is caused by this. Yesterday only we have learned this thing in a microbiology, sir. It is caused by Echinococcus granulosus or dog tapeworm, where you are going to see the definitive host. Who is a definitive host and who is an intermediate host, sir? Who is a definitive host and who is an intermediate host? From the yesterday only I have taught you, sir, who is a definitive host. The intermediate host is man or sheep, and definitive host is bow bow, that is dog, that is dog, that is dog. Beautiful answer. And here it is water lily sign. Water lily sign. In the surgery also we are going to talk about this again, and we are going to talk about the technique by which we will get rid of this. Now my dear friends, gallstone. This investigation is, can you identify the investigation which is shown in the image right here, sir? Which investigation is shown in the image right here, sir? Which investigation is shown in the image right here, sir? This is ultrasound, ultrasonography, and this is something called as posterior acoustic shadow. If posterior acoustic shadow is present, that means this is a radiolucent gallstone. Radiopaque gallstone. Radiopaque gallstone. Done, sir? So this is for the investigation of choice in case of a gallstones. In the radiology, just this thing you need to know and you are good to go. Now coming to the diaphragmatic hernia, my dear friends. Diaphragmatic hernia. Okay? Now diaphragmatic hernia, what is happening? When the baby is born and the diaphragm is very weak, weak diaphragm lead to the protrusion of intestinal content in the thorax. So this condition requires the treatment. First of all, resuscitation we need to do, IV fluids, etc. we need to give to such patient, and then we have to reposit it. Okay? Good. Okay? Now can you tell me, anyone guesses the type of congenital hernia? Boldeck. Yes, Boldeck type is there. One more type is there. Okay? Most common is Boldeck type of congenital diaphragmatic hernia you are going to see, sir. Now coming to the next we have talked about, and that is what, sir? Your, yes, Morgagni and Boldeck. Morgagni is more common than the Boldeck. Okay. Now Crohn's disease, you are going to see the string sign of Cantor. If you can appreciate right here, sir, string sign of Cantor. This is again a feature of Crohn's disease, what we were discussing of. This completes our 19 diagnosis in case of what, sir? Your GIT. Now I'll one by one ask you the questions. Can you identify the disease? Just showing you 4 to 5 images just to know the radiological diagnosis you are able to find or not. And rest are the extra points you can keep on adding in your brain simultaneously. My dear friends, yes, please let me know. CHD, that is congenital diaphragmatic hernia. Beautifully diagnosed. Everyone has done a very beautiful job. Now we are good to start with the next system, and that is going to be the respiratory system, sir. The next system we are going to start is respiratory system, sir. Respiratory system. And for number one, we have to talk about the atypical pneumonia, sir. Atypical pneumonia, sir. Atypical pneumonia. The most common cause of atypical pneumonia is going to be mycoplasma. Yesterday itself we have learned about this, sir. Atypical pneumonia. This is going to be the mycoplasma. Mycoplasma is gram positive or gram negative? My first question for all of you. Mycoplasma, and this is previous year question. Mycoplasma is a cause of atypical pneumonia, where on the X-ray you will see the opacities. Multiple opacities you are going to see on the chest X-ray. This is atypical pneumonia. Please let me know, this is what, positive or negative? Mycoplasma is gram negative acid fast bacilli. Very good. Chalo. Coming to the 𝗝𝗵𝗵𝗵 pneumoniae, 𝗝𝗵𝗵𝗵𝗵. You can see right here, sir. And also, can you tell me the cause of, gram positive it is. Can you tell me the most common cause of typical pneumonia? It is gram positive. It is gram positive. Yes. Typical pneumonia. Can you tell me the cause of typical pneumonia? Pneumococcus pneumoniae. Pneumococcus pneumoniae. They both are what, sir? Gram positive. Gram positive. Now, 𝗝𝗵𝗵𝗵𝗵𝗵𝗵. So, 𝗝𝗵𝗵𝗵 pneumoniae will lead to bulging fissure like this. You can very well appreciate right here, sir. Opacity on the right side, upper lobes are involved. This is bulging fissure present, and this is going to be the 𝗝𝗵𝗵𝗵 pneumonia, sir. Now coming to the aspergillus. Aspergillus is a fungal infection caused by aspergillus. Aspergilloma is a fungal infection caused by aspergillus. Aspergillus. Now what you are going to see right here, sir, this air crescent sign on CT scan. It is asked in your previous exam, sir. Air crescent sign on CT scan is a feature of aspergilloma. Now, sir, miliary TB. Miliary TB, if you see, sir, hematogenous root spread is going to be there, and millet seed pattern you can very well appreciate. This is HRCT, and this is going to be the chest X-ray where you're going to see the millet seed appearance. Sir. Now coming next to the Gons focus and Simon focus, that also we have learned yesterday. Sir, primary TB, in the primary TB, which is most common in the children, the middle to the lower lobes are involved. And the focus you are going to see is Rankine plus Gons. Rankine plus Gons focus you will see in the middle to the lower focus. And Simon focus is seen in the secondary TB. And this is involving middle to the apical lobe, sir. And here you are going to see the ऊपर क्या होता है आसमान focus और Simon focus. So primary TB, in short, you have to remember, primary TB के अंदर middle to the lower lobes are involved, and the focus you are going to see Rankines and Gons. In the secondary TB, sir, middle to the apical lobes are involved, and the focus you are going to see Simon and Asman focus. These are the focus you are going to see. Now pleural effusion, pneumothorax, important topic. Sir, pleural effusion, when there is a fluid inside the pleural cavity. So understand right here, the CP angles are blunt now. Now patient is having difficulty in breathing also. And also patient might be cyanosed also. My dear friends, what a treatment you are going to give to such patient? Sir, you are going to give this patient tube thoracostomy. Tube thoracotomy. How you are going to do the tube thoracotomy? If this is a rib, my dear friend, you are going to go for the upper border or lower border. Yes, tube thoracostomy we are going to do. Yes, upper border or lower border. Sir, you are going to go from the upper border, because on the lower border neurovascular bundle is present. I taught you well in the anatomy class we have learned on the very first day, sir. Yes, very nice. Pleural effusion. Sir, the most common in the adult is going to be the most common space in adult is going to be the 5th mid-axillary. And in the children, it is going to be the 2nd mid-clavicular. Now coming to the same condition, pneumothorax. Now, पानी की जगह क्या भर गई? हवा. So you can see your lung is getting collapsed, and between visceral and the parietal pleura, you will see complete air, which is making it collapse. In this also, you will do a tube thoracotomy. Very good, perfect. Now, tension pneumothorax. What is happening in the tension pneumothorax? The air is coming out inside but not going outside. The flaps are not allowing air to go outside. Massive air is trapped and lung is severely collapsed. Along with that, your trachea is deviated to the other side. This is an surgical emergency, my dear friends. Now, what treatment you are going to offer right here, sir? This is a surgical emergency. What treatment you are going to offer right here, sir? Yes, please let me know. Needle thoracosynthesis, needle thoracosynthesis with the wide bore needle, yes my dear friend, coffee bean scrub, yes, very good, it is needle thoracosynthesis. And if you see the air and water in the same compartment, air bhi ghus gayi wahan, pani bhi ghus gaya, there is a flat line, and straight away radiological diagnosis is going to be a hydropneumothorax. Going to be what, sir? Your hydropneumothorax. Done. Now coming to the next finding you are going to see in the respiratory system, and that is going to be the cannonball appearance, sir. Cannonball appearance. My dear friends, cannonball appearance. Why it is seen so? Any cancer, including any cancer in the body, if it go to the lungs, it will form this cannonballs. It will form the, irrespective of anything. Any cancer metastasizing to the lung will show us cannonball appearance. Now, sir, Pancoast tumor, the most common area which Pancoast tumor is involving is right side apical mass. You are going to see. You can very well appreciate right here, sir, right in the right place, apical mass. Now, this will lead to the Pancoast syndrome. Pancoast syndrome. In Pancoast syndrome, you are going to have a pain, you are going to have a muscular brachial plexus involvement. If it is growing big, here are the brachial plexus involvement will be there. And sir, there will be a atrophy of the upper limb muscle, sir. Can you tell me which splint you will give to such patient where brachial nerve is getting injured? Can you just guess the name of the splint you are going to give such patient in case of a brachial plexus injury, sir? And my dear friends have given a very correct answer, and that is none other than your aeroplane splint. That means you people are well revised, well taught, well remembered, very nice. And then also this patient is going to have a Pancoast syndrome. Now Pancoast syndrome is multiple time taught to you, all of you. Pancoast syndrome आपको बार बार पढ़ाया जा चुका है, अब आपके दिमाग में बस चुका है. सर एक निमोनिक तो बताया था आपने, female. What is this female, my dear friends? Ptosis, meiosis, anhydrosis, loss of ciliospinal reflex and anophthalmos. Sir, what test we are going to do to check this syndrome? Horner syndrome. Can you tell me Horner syndrome? Which test we are going to do? I taught you there in the pharmacology itself, sir. Horner syndrome mein, sir. Yes, Horner syndrome mein which test? Which test, my dear friends? Someone was dilating the eye, and that was none other, and that is metabolized by pseudocholinesterase. That also hint I am giving you. Sir, that is also called as white lady, sir. Another hint I am giving you. अब तो पहचान जाओ लाडलो, क्या कर रहे हो? Yes, join our Telegram channel Conceptual Medicine to get the PDF annotated and unannotated also, and also daily content. So the answer is cocaine, sir. Cocaine, sir. Shabash, mere shero. क्या बात है? क्या बात है? Very good, very nice, very. So Pancoast tumor is done, sir. Pulmonary hamartoma, there is a popcorn calcification you are going to see in the lungs. Sir, what about this? If this popcorn you will find in the breast. Breast में अगर popcorn मिलने गया तो fibroadenoma. Two popcorns, one is chest, another is there fibroadenoma. Plus one popcorn cells we were seeing somewhere in the pathology. Just giving you two options, choose one, Hodgkin's or non-Hodgkin's. Popcorn cells in the pathology you will see in the Hodgkin's or non-Hodgkin. A very simple question. Hodgkin or non-Hodgkin? Guess tukka marna ho to bhi kya maroge? Yes, the answer is very correct. That is Hodgkin's lymphoma. This is how you are going to work in the exam, and this is how you all are going to pass this exam. No one can stop you. May God bless you. Love you all. Truck bhar ke. Chaliye sir, let's talk about the next one. Bronchiectasis. Irreversible destruction to the bronchi. Irreversible destruction, restrictive lung disease. On CT scan, you are going to see the signet ring appearance. Signet ring look like this. Look like this. This is signet ring. Aise upar, upar. This is signet ring. Or also, one more appearance is tram tract appearance, TTA. That is your ट्रैम ट्रैक अपीयरेंस. हाँ तुक्का ही था, तुक्का था, अच्छा था. ठीक है, चलिए ट्रैम ट्रैक अपीयरेंस. Coming on to the next part called as what's your sarcoidosis, my dear friends, ladies and gentlemen. Sarcoidosis. Sir, sarcoidosis, abnormal growth of inflammatory cells you are going to see, and bilateral hilar lymph adenopathy you are going to see. One more sign in sarcoidosis you are going to see, that is called as panda sign. Panda sign, panda sign, panda sign. Now one more question sarcoidosis ka. Sir, sarcoidosis is a causative organism for the anterior uveitis, is a condition associated with anterior uveitis, intermediate uveitis or posterior uveitis. Sir, anterior uveitis, intermediate uveitis और posterior uveitis. Yes, yes, ophthalmology कल पढ़ाई थी, उसमें से सवाल आना चाहिए, अभी आएगा निकल के मजेदार तरीके से. You are going to no again तुक्का मारना, इतना भी गंदा नहीं मारना. Sarcoidosis is the second most common cause of sarcoidosis is second most common cause of intermediate uveitis. Intermediate uveitis, my dear friends. Anterior का HLA B27 था. Intermediate uveitis. Now coming on to the next structure is emphysema. Emphysema is an obstructive lung disease where compliance is less. Recoil is not. Compliance is there, recoil is not. Because of the compliance, the chest is going to be the barrel-shaped chest. The chest is going to be the barrel shape. This emphysema is of two types mostly. One is centriacinar, one is panacinar. Centriacinar is because of smoking, and panacinar is because of alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency. And the smoking part will lead to squamous cell carcinoma. The smoking part will lead to what, sir? Squamous cell carcinoma. And sir, this antitrypsin deficiency will lead to adenocarcinoma. What is going to happen? There is going to be the barrel chest. The vital capacity of the lung is going to increase. What about the FEV1 percentage? The air which is coming out, is it going to decrease, increase or stay normal? ये मैंने आपको physiology के अंदर पढ़ाया था sir. I have taught you well in the physiology this thing sir. Can you tell me? FEV1 percentage, I am asking you. This is going to be decreased, my dear friend. Very good answer by everyone. The absolutely correct answer. Now silicosis. Silica dust की वजह से होता है pneumoconiotic disease where you are going to see the egg shell calcification. जैसा अंडे का बाहर की परत होती है वैसी calcification you are going to see. Now sir, if there is a case of pneumoperitoneum, which sign is this? You have already answered this sir. Which sign is this sir? Pneumoperitoneum, which sign we are talking about, my dear ladies and gentlemen? Which sign we are talking about? This is what called as cupula sign. This is what called as cupula sign. If you will see the peritoneal perforation, my dear friends, the first, this was exam question, that is why I have written this. Next step is directly you will not go for the exploratory laparotomy. First you will give the IV fluids, my dear friends. IV fluids, my dear friends. IV fluid, my dear. Then you will go for the exploratory laparotomy. If someone is asking you pneumoperitoneum ka case is there, what is the definitive management? Then you will mark answer as exploratory laparotomy. And if someone is asking you before exploratory laparotomy, what you will do? Your answer should be IV fluids. Your answer should be what, sir? IV fluid, IV fluid, IV fluid. Now what is consolidation? With the air bronchogram, when air is replaced by fluid inside the lungs, my dear. COVID-19, what you are going to see? Multiple glass ground opacities, multiple glass ground opacities, glass ground opacities. Pneumocystis jirovecii, HIV positive and bilateral glass ground glass appearance, ground glass appearance. Done, done, done. Clear okay, Fanda? Now I will ask you some X-rays and you will answer me, sir. Sir, please make the diagnosis. Very good answer hai ji. Wow, diagnosis. This is going to be the Military TV. Shabash mere shero. Sir, diagnosis. This is pneumothorax. Naughty boys and girls. The diagnosis is going to be hydropneumothorax. Hydropneumothorax. Bolo hydropneumothorax. Yes, 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 yes. Yes, 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 yes. Can you tell me popcorn calcification in the chest X-ray is seen in pulmonary hematoma, क्या बात है, बहुत बढ़िया आंसर दे रहे हो, खुश हो गए दिल. Yes, this is what squiosis, bilateral hilar lymphadenopathy. This is cupula sign, pneumoperitoneum. Very good. Clapping. We finish one system. Now we are going to do the another system, which is cardiovascular system, and this system is integrated with your pediatrics, my dear ladies and gentlemen. Okay, chalo, let's talk about this cardiovascular system. First of all, the number one thing we are going to study is TGA, transposition of great arteries. Now what is happening right here? On X-ray you are going to see egg on string appearance. संडे हो या मंडे, रोज खाओ अंडे. अभी अंडा किस पे लटका हुआ है? धागे पे. So my dear friends, what is happening right here? Now your aorta, क्या ओटा ना खोटा मुंह खोटा खोटा सिक्का. Aorta is abnormally arising from right ventricle. Normally tell me, aorta should arise from where? अब ये right ventricle से arise हो रहा है aorta. कहाँ से arise होता है aorta? राइट का उल्टा क्या होता है? इट इज लेफ्ट साइड, माय डियर फ्रेंड्स. बट हियर इज अ प्रॉब्लम, इट इज अराइजिंग फ्रॉम द राइट साइड. दैट इज व्हाई द अपीयरेंस इज लुकिंग लाइक अ अंडा. तो एग ऑन स्ट्रिंग अपीयरेंस, एग ऑन स्ट्रिंग अपीयरेंस. आंसर इज गोइंग टू बी व्हाट सर? Egg on string appearance. So egg on string appearance. Why? Because aorta is abnormally arising from the aorta right ventricle. Done, done, done. Now coming on to the TAPVR. Somewhere it is called TAPVC also. TAPVR, what is happening, sir? Figure of 8 appearance or snowman appearance. Yes, I'll draw snowman for all of you. This is called as snowman appearance. Chalo. Now this snowman appearance, why this is so? Why this is so, my dear friends? The pulmonary vein which is supplying oxygenated blood is draining into right atria. Is draining into right atria. Where it should drain? Can you tell me? Pulmonary vein which is supplying oxygenated blood, where should it drain? जब आपके राइट वेंट्रिकल से निकल के पल्मोनरी आर्टरी जाती है लंग्स पे, लंग्स से पल्मोनरी आर्टरी कहाँ जानी चाहिए? पहले लॉजिक लगा के बताइए. इट शुड कम इन द लेफ्ट एट्रिया. नाउ इट इज कमिंग इन राइट एट्रिया. यस माय डियर फ्रेंड, and that is what problem happening here, and because of which you are having a figure of 8 appearance and this is Santa Claus appearance. Now my dear friend, another question is figure of 8 appearance. The figure of 8 brace is used for, or you can say splint or sling is used for. Figure of 8 sling is used for. Orthopedic question, just taught you yesterday only. That is why I clearly asking all of you, my dear friends. This is going to be the bilateral clavicular fracture. Bilateral clavicular fracture. Chalo, sir. Now coming to the tetralogy of Fallot. Tetralogy of Fallot, sir. Tetralogy of Fallot having a 4 components, sir. What is 4 component they are having, sir? POVR. This is how I remember. POVR. P for pulmonary stenosis, sir. P for pulmonary stenosis, sir. V for ventricular septal defect, sir. O for overriding of aorta, sir. And R for right ventricular hypertrophy. Sir, because of this right ventricular hypertrophy, you are going to see the boot-shaped heart, sir. Boot-shaped heart, sir. And if I add one more feature, it will become pentology of Fallot. Can anyone guess which one feature we will add to this and it will become pentology of the Fallot? This is going to be the atrial septal defect, my dear friends. Atrial septal defect, my dear friends. Now, coarctation of aorta. Persistent narrowing is seen in the aorta, which will lead to the figure of 3 appearance. Which will lead to the figure of 3 appearance. Figure of 3 appearance. Okay? Okay? Chalo, done. Now, pericardial effusion. Okay? Chalo, done. Pericardial effusion. Okay? Chalo, pericardial. Money bag or leather bottle appearance. Pericardial effusion में क्या हो रहा है? If this is a heart. If this is a heart, दिल के आसपास क्या भर गया? पानी. तो क्या बोलता है? सैया ने देखा हमको ऐसे, मैं पानी पानी हो गई. So याद रखना, there is a water near in the pericardium space. ठीक है? How you will treat such condition? क्या करोगे आप? वहाँ पे needle cardiosynthesis we will do. Done, done, done. Epstein anomaly. What is this Epstein anomaly, my dear friends? There is going to be the box-shaped heart. Why this is box-shaped heart? It is because of the enlarged ventricles. This Epstein anomaly is associated with which toxicity? My question for all of you, sir. Epstein anomaly is, yes, lithium. Lithium. Lithium is a mood stabilizer given during the pregnancy and this is causing the problem. ठीक है? Both the ventricle? Yes, my dear Shweta friend, right more than left is the correct answer. Congestive heart failure, 4 important features you have to remember of, sir. Congestive heart failure, my dear friends, you have to remember. First is increase in cardiothoracic ratios. Second is pleural effusion, sir. Third is cephalization of the vessels, sir. Fourth is curly B line, sir. These are the 4 features you are going to see. Also, bat wing appearance, yes, we see. Bat wing appearance, congestive heart failure, acute congestive heart failure, chronic congestive heart failure, that we are going to study in the medicine ka topic, sir. Medicine. Now, constrictive pericarditis. Constrictive pericarditis, there is a thickening or you can say calcification of the pericardium and this mimics the TB. TB ke andar you will see the calcification like this and here you are going to see egg in cup sign. ऐसा लगता है जैसे अंडा डाल दिया कप के अंदर, तो egg in cup sign, egg in cup sign, tubular heart. Yes, my dear friends, Swami Lucky. Now, aortic dissection. What is happening? A tear in the internal layer of the aorta will lead to the tennis ball-like appearance. The true lumen, right here you will see, there is a tear in the luminal layer of the aorta and this is going to separate from the true layer, and true layer is this layer which is more white and this is false lumen. This is false and true, it is looking like a tennis ball, that is why called as tennis ball-like appearance you are going to see in the aortic dissection. Aortic dissection. This completes our CVS also. Sir, figure of 8 appearance is seen in 𝗲𝗵𝗴𝗺, 𝗲𝗵𝗵𝐶, very good. Tetralogy of Fallot, where boot-shaped heart is seen. What are the 4 features we are having? Tetralogy of Fallot. What 4 features we are going to see? POVR. Sir, egg in cup appearance. Constrictive pericarditis. Sir, egg on string appearance. Sir, egg shell calcification. तीसरा अंडा. Egg shell calcification. Silicosis. Coming on to the next system, CNS. You will see ischemic versus hemorrhagic stroke, my dear friends. We are having an image of NCCT head. In this, if there is a hemorrhage, there will be a white area. If there is a ischemia, there will be a black area, sir. A typical radiological diagnosis if you have to make between the hemorrhagic and the ischemic. Why this ischemia is happening? Because of the thromboembolism. Because of thromboembolism, this ischemia is happening and treatment is going to be the antithrombotic agents like erytipase, etc. Done, sir? Now, hemorrhagic stroke is happening mostly because of the hypertension, EDH, SDH. Now here the primary motive is control little bit of BP plus give the perfusion. ठीक है, चलो done. Then coming to the hemorrhagic stroke के अंदर हो गए, which in the stroke which artery is bleeding, which area is bleeding? Can you tell me which area is bleeding and which artery is most commonly bleeding? In the hemorrhagic stroke, the area bleeding most commonly is putamen, and the artery which is bleeding most commonly is going to be the mid-cerebral artery, MC artery, mid-cerebral artery. Subarachnoid hemorrhage. Sir, there is going to be the thunderclap headache. There is an injury to the subarachnoid space, or you can say what is bleeding? Berry aneurysm. Berry aneurysm. You can very well see right here, sir. Berry aneurysm is getting bleeded. Done. Now, subdural hemorrhage. Subdural is like a sickle-shaped hemorrhage. Sickle-shaped hemorrhage. तो कहता है सबको पार जाना है नदी के, कैसे जाएंगे? ब्रिज से. तो इंजरी इज गोइंग टू बी टू द ब्रिजिंग वेन्स. Then coming to the EDH, multiple time asked question in the exam. Let's talk about the extradural hemorrhage. Extradural hemorrhage you will see right here. Plano-convex. E for extra, E is like a idli. Who makes good idli? Mamma, MMA. Mamma makes very good idli, that is middle meningeal artery. You are going to see the lucid interval. What is lucid interval here, sir? The patient will be awake and patient will be what, sir? Drowsy. Or you get conscious and unconscious is a better word. Conscious, unconscious. Conscious, unconscious state will come. This is what called as lucid interval. Now coming on to the next one is 𝗪𝗪 syndrome. 𝗪𝗪 syndrome. Sane insane wala alag hai. Mostly conscious, unconscious is mostly associated with this. and also sanity, insanity can also come, but mostly conscious unconsciousness will come. Now sir, 𝗧𝗲𝗹𝗏 syndrome, you are going to see the port wine stain right here sir, plus you are going to see the tram tract calcification. Tram typical feature. Neurocystic sarcosis, yesterday only we have learned in the microbiology, neurocystic sarcosis is caused by Taenia solium. This is a tapeworm caused due to eating of a uncooked pork, and there will be a cyst in a dot or dot in a whole appearance. You can appreciate right here sir, cyst in a dot or dot in a whole appearance. Okay? Multiple myeloma is a plasma cell tumor. Here you are going to see the loss of Benz-Jones protein. On the X-ray skull you are going to see raindrop pigmentation, and other bones you are going to see the punch out lesion. Typical finding, radiological finding. Paget's disease, old bone replaced by new bone is faulty now, my dear friends. Can you tell me this cotton wool skull is seen in which stage of Paget's disease? There were the 3 stages we have talked about yesterday. Mixed stage. Can you tell me the other finding you will see in the Paget's disease? Picture frame vertebra. Yes. Grass blade sign, flame sign, diffuse axonal injury. You can see hypodense foci on NCCT. Axon are getting damaged. This is putamen area. Axons are getting damaged. Diffuse axonal injury. Meningioma, dural tail sign is there. Plus psammoma bodies you will see. Most common benign tumor. Then blastoma multiforme, butterfly shaped tumor you are going to see. This is a malignant tumor of the brain sir. Oligodendroma sir. Remember calcium deposition you will see on the CT scan right here sir. Very nice. Yes. Fried egg cytoplasm is also feature of oligodendroma glioma sir. Putamen bleed, as we already talked about, mid cerebral artery is going sir. And the reflex which is going to be positive is Babinski's reflex sir. On touching the extremities there is going to be the fanning of the finger, that is Babinski positive sir. Now Mount Fuji sign you are going to see in the tension hydropneumocephalus. Question number 1 I am going to ask you sir. Cyst in a dot or dot in a hole sign is seen in neurocystic sarcosis. Very, very good. Bridging veins are getting damaged in which disease? SDH. Sir, tram tract appearance plus port wine stain. What we have to think of? 𝗧𝗲𝗹𝗏 syndrome. Sir, signet ring appearance is a feature of bronchiectasis. Very good. Let's talk about the next system called as renal system. First of all, staghorn calculi, you can see triple phosphate stone, most commonly seen with the young boys. Horseshoe kidney, where 2 lobes of the kidney they are fused together. On intravenous pyelogram, what you are going to see? The flower vase appearance, and on this CT scan you are going to see 2 horseshoe appearance. Duplex pelvic ileal system, you can very well see. This is 1 pelvic ileal system, this is 2 pelvic ileal, and this is like looking like a drooping lily. This is called as drooping lily sign. This is called as what sir? Drooping lily sign. Ureterocele. Now there is a cystic dilatation in the ureter inside the bladder. This is looking like a adder head or cobra head appearance. Sir. Posterior urethral valve. Now your valve is obstructing your urethra. The male child will be having a complaint of obstruction of flow. On sir, micturating urethrogram, you are going to see there is an obstruction of the flow, and ultrasound ke upar. This is USG examination. On USG examination, you are going to see the keyhole appearance. You are going to see what sir? Keyhole appearance. Now neurogenic bladder, the sphincter tone of the bladder is increased, because of that which the dye which coming inside is going outside like a tree like this. So remember, this is a Christmas tree appearance. This is called as Christmas tree appearance. Polycystic kidney disease. On IVP, you are going to see the spider leg appearance, and on CT scan, you are going to see the multiple cysts, sir. Renal TB, putty kidney, medullary nephrosis, you are going to see the microcalcification of the nephrons. This is an investigation called as micturating ureterogram, which was diagnosing us the posterior urethral valve we were talking about. Posterior urethral valve we were talking about. Then the next system we have to talk about is a musculoskeletal system. Sir, this is due to the deficiency of vitamin D in children, it is ricket, and in the adult it is going to be the which disease? If there is a vitamin D deficiency in the adult, which disease we are thinking of? Vitamin D deficiency in the adult, we are thinking of what, sir? Osteoporosis. Very, very good. This is cupping sign. This is ricketic rosary. Also on head we are going to see. On the head we are going to see. The hint I am giving you. Please try to identify. Head पे कौन सा sign देखने मिलेगा sir? Craniotaps, sir. Scurvy. Due to deficiency of vitamin C, white line of freckle you are going to see. White line of freckle you are going to, plus gum bleeding you are going to see. Hyperparathyroidism, rugger jersey spine we were talking about, sir. Hyperparathyroidism, where calcium resorption is happening, serum calcium levels are increased. Done, sir. Salt and pepper appearance will also seen, sir. In fingers there is going to be the brown tumor, sir. Thalassemia we were talking about. This sickles, this chipmunk face is exclusively for the thalassemia. Menzer index was there more than 13, sir. We have talked about, sir, yesterday only, sir, in the pathology session, sir. Sickle cell anemia is having both. One is your crew cut appearance or hair end appearance. This is a feature of both thalassemia and sickle cell anemia. And sickle cell anemia will lead to splenectomy. After splenectomy, which bodies are seen? Howell-Jolly bodies. Howell-Jolly, yes. Spinal hemangioma, you are going to see what's a polka dot sign and 𝗲𝗲𝗴𝗍 sign. Polka dot sign and 𝗲𝗲𝗴𝗍. Fibrous dysplasia, there will be a 𝗲𝗵𝗵 deformity in the fibrous dysplasia, where you will see a ground glass matrix in the metaphyseal region. Ground glass matrix you are going to see in the metaphyseal. This will lead to a 𝗲𝗵𝗵 deformity. This is again a previous year question of the exam, sir. Now, arthritis, osteoarthritis versus rheumatoid arthritis. Sir, osteoarthritis is a degenerative disease and rheumatoid arthritis is an inflammatory disease. Inflammatory disease. The patient will be complaining of early morning stiffening of the fingers for more than 30 minutes. C-reactive protein, etc. we are going to investigate, and this is how we will make the diagnosis and treatment with DMARD, etc. drugs we are prescribing. Then, sir, osteoarthritis, the most common joint involved is knee joint. Most common side involved is medial side. Medial side. Okay, X-ray bilateral standing, bilateral knee standing view, epilateral we are going to perform. In that we are going to diagnose this osteoarthritis. Now, sir, swan neck deformity and Botnius deformity. Yesterday also I have told you. Can you just tell me what is happening on PIP and what is happening on DIP in all of them, sir? If you know one, you will be able to tell others. स्वान नेक PIP में क्या हो रहा है? हाइपर एक्सटेंशन. DIP में फ्लेक्शन. Opposite will happen here, flexion, and opposite will have a hyper extension. This is how beautifully you will separate, and these are seen in rheumatoid arthritis. Charcot's joint or neuropathic joint, it is seen in diabetes mellitus patient. It will look like a fracture, but this is not a fracture. These are the osteophytes which are deposited right there, and they are the painless condition. They are what's that? Painless condition. Multiple myeloma we already did. Extra edge, CT scan, PET CT, and PET CT you will see the radioisotope we use is 18FDG. And this is used for the metastasis. This is used for the metastasis. Now, X-ray of the breast is called as, your answer is going to be the mammogram. Mammogram. This is going to be the mammogram. Then technetium scan is there. The cold nodule you can see right here. Uptake is not there. When uptake is fully there, this is called as hot nodule. On the basis of this, you will see this is Graves' disease, where a Batman type of appearance is going to see. Multitoxinodular goiter is going to be there, hot and cold, both nodules you can see. And here you will see there is a cold nodule completely, where there is an absence of one nodule. And this is autonomous nodule. And here is going to be the thyroiditis, where there is going to be the small uptake of the radioisotope. So this is technetium 99 scan we were doing to diagnose the thyroid gland disorders.